This meeting is being recorded.
Okay.
Right. So this is what generally the life cycle of a claim is all about.
Okay.
In the previous session, we have discussed about the HIPAA rules and regulations, followed by
Right.
the kind of standards of HIPAA, all that.
Mhm.
Wherein this is completely a life cycle of a claim. The amount of time will be taken for a processing of claim usually will be taken somewhere around 60 to 90 days of time. Usually we say it is 30 days, but this may go up to 60 to 90 days of time. Depends on the adjudication process, which normally it takes. So depends on the case to case of the claim, what is that we have submitted. Depends on the kind of queries it has. This may get extended to the next level. Okay. Now, when we talk about these in stepwise procedure, the first one is called general office processing. This is the first step which normally we follow. Here, the kind of sorting out the documents, whatever we are about to submit, everything will be sorted out based on the demographics. Because claims will be submitted from different parts of the location, isn't it? Right. So different parts of the locations, claims will be submitted. As far as the rules and regulations and policies and procedures itself is concerned, in context to the Medicaid I'm talking about. Rules may vary, that's what I said. But of course, in context to Medicare, we don't see any rules changes. But in Medicare, it changes. So why demographics are we taking into consideration? Because rules and regulations in context to Medicaid may vary. That's the reason why, especially for a business analyst, normally whenever we work in healthcare, we must be knowing about the business rules. Business rules are important.
Right.
Let me explain you what exactly business rule is. Of course, being a learner of business analyst earlier, I think you might have had an idea over the business rule, but let me explain from my end.
Yes.
This is nothing to do with healthcare. This is nothing to do with
Right.
any investment banking or domain or something. Business
Right.
rules are the one which are majorly useful for any business to run. Means if there is any business activity we want to run, there are a lot of procedures, lot of steps to be taken. Initiatives will be taken by the business owner or a business representatives to make them operative, whatever the operations of their business they were doing, in order to make it more effective and qualitative. Whatever the procedure they have to follow the procedure based on some rules and regulations.
Right.
If you don't frame any rules and regulations, people follow the way what they can. But usually it will not give you any quality output, point number one. It leads to indiscipline at business. This will not be sustained for a long time. So that creating a business rules are very much important for any business. Now, being a BA, why do you require to learn business rules? Not learn. Why do you require to know about business rules? Because the kind of solution we are going to provide being a BA, this is nothing to do with only solution. Because the solution is an integral part of the business. Let me put you this way. For example, we are developing a claim management system to one of the healthcare organization. Roughly speaking. Of course, there are existing claim management softwares are there in the market. You could ask me, Raj, they can buy the product, right? So why do they ask us to develop? Maybe for different reasons. Whatever the reason it could be, end of the day, customer has asked us to develop a claim management system.
Right.
Claim management system is an integral part of the healthcare process. That's not only the element. There are other elements here. Even patient management system, at the same time, doctor's appointments, right? There are a lot of things are involved, but claim management system is what a healthcare organization or a healthcare provider, I can say. Provider, at the same time, provider will be there. Provider has asked us to develop a healthcare claim management system. Now, when we talk about claim management system, process of claims or procedure of the claims remains constant in any healthcare department. That never changes. But
Okay.
the kind of effectiveness in reference to the claim processing or the kind of approach slightly may vary, depends on the kind of business rules what that organization is belongs to entity, right? Because
Okay.
I'll give you a detailed more example. When you talk about healthcare provider, who are healthcare providers? It may be a hospital, it may be a doctor. I'm talking about
Right.
clinic, right? Doctor
Right.
means a normal clinic where it was located somewhere in our places. Because for
Right.
small things, we can go and meet the clinic doctor, right? So we don't go to the hospitals. Usually we don't.
Right.
So those people are also called as healthcare providers. Even nursing people, these people
Right.
are called as healthcare providers. Okay. If you see, if you talk about hospital will have some rules and regulations to follow if there is any procedure we are following. Right. So the kind of business rules what they frame is entirely different than a clinic. Because clinic
Right.
is small in size. The operations means the kind of activities happens in any clinic will be limited in its percentage because they don't see much infrastructure, no infrastructure, nothing. Even if there is any kind of scanning or X-rays required, again, you have to go to the nearby place, to the diagnostic center, and we have to get it. That's how it is. So business rules may vary, depends on the kind of healthcare provider to healthcare provider. Do you understand this? Right? Point
Yes.
number one. Point number two, there will be some healthcare providers where they will be connecting to R&D because there will be some huge healthcare organization you can see, huge ones. Those are not hospitals. Those are research centers, healthcare research centers. Attached with that is hospital.
Right.
Attached with it is hospital. More example I can give. For example, if you take any medical colleges, right? So medical colleges are the one which will be used to teach medicine to the students. But to have some practical knowledge over that, what is required here? They should have a hospital. Either it could be how many bedded hospital it could be. There must be some specification based on that they need to run the hospital equally. Why? Because whoever is undergoing the teaching in the college, medical college, they have to do some practicals. Of course, practicals are not on the patients. Usually, some small things they have to learn. Right. So with other doctors, they have to learn by behind them. They have to see the kind of situations, right? So everything they have to respond to what kind of situations, how to respond. Some sort of practicality they need to learn. Not directly dealing with patients as they are not experienced, but they'll be assisting with some senior doctors on that. So healthcare units, when you talk about hospitals, the kind of business rules and regulations, what they have is different. At the same time, if it's a research organization, right? So healthcare research R&D organization, the kind of business rules, what they have is different because healthcare research and development organizations are more focused towards research and development, right? Research and development is their major agenda, right? So major agenda is on research and development. Apart from that, they run even hospitals also. So the business rules in reference to the healthcare providers may slightly vary from organization to organization sometimes. The reason why, whenever we are talking about the claim processing or in context to the role of a business analyst, knowing about the business rules of customer is essentially important. So this is the one I can represent, I can relate this to any industry. And not, of course, ours is healthcare. Hence, I have given an example for healthcare. You can relate this example to any of the domain, whichever people can look for, right? So business rules, knowing about the business rules, because see, business rules won't be framed by BA. underline this point. We don't
Right.
frame business rules. Business rules were existing. Business rules
Mhm.
will change from time to time. It will not be remains constant. Depends on the changes in the industry happens. Business rules may slightly vary based upon the business decisions, what the board of directors or the head of the people will be taken. But understanding the business rules is important for any VA. In this
Okay.
context, being a business analyst, one should be knowing about the rules of the business. So when you are working on real environment, whenever you are working as a business analyst, as an interference to the healthcare, please do
Mhm.
remember, you need to understand the business rules first. Unless until if you don't know the understanding the business rules, providing solution will not be much equal. Because
Mhm.
the rules and regulations of the business is entirely different than the solution what you have given. So then
Right.
there will be no value for the solution what you have given, even though to your context it is right, but it is not aligning to the business rules of the organization. Right. So this is the first
Right.
thing. Now coming back to the point in reference to the life cycle of a claim, the first one we call it as general office processings, where we must
Right.
be knowing about the demographics. Depends on the kind of demographics what the plan relates. Based on that, this will be varied, right? So this sorting out the data and all everything will be happened in the first level. So based on that, the second level, this coding department will be coming into picture. This is where generally medical coding department we talk about. So
Mhm.
this is what generally you can see here, right? So there will be a biller where what this billing person do. Billing person has to add all the information of the patients followed by the patient visits, cost of procedures, everything into the claims, right? So if you want to create any kind of claims and all that, this coding person and biller and all everything has to prepare it, isn't it?
Right.
Right. So
Yes.
this is the second step happens here. This is where generally this coding department will process this. So
Okay.
whenever they are processing all these, they have to use a codes which are, we call it as ICD codes, right? So these ICD codes and procedure codes, diagnosis codes and all everything will be varied here. This is how generally the classification of ICD codes generally we do. One of the classification of ICD code sets is called ICD 9CM. Okay, if you want, you can write ICD
Yeah.
9CM. Please write it. ICD stands for International Classification of Diseases. Please write it. Of course,
Yes.
that is your choice. If you want to take a screenshot, or else you can write.
I did. I actually
Right.
took screenshot.
Thank you. Right. So International Classification of Diseases, full form of ICD is ICD 9CM codes. This
Okay.
ICD 9CM are the official codes which are assigned to the medical diagnosis and as well as procedures, which are relating to the hospitals. Right. So this is what
Mhm.
generally this ICD 9CM codes were. So in context to the ICD 9CM codes, whenever we have, there are different other codes called HCPCS codes, right?
Mhm.
One is
HCP.
ICD codes, point number one.
Right.
What are those codes? I'll explain one by one later, right? On a high level,
Okay.
ICD 9CM codes are one thing. Second is HCPCS codes, level 2 codes,
Mm.
right?
Yes. I know.
HCPCS stands for Healthcare Common Procedure Code System. HCPCS level codes are majorly used to identify and as well as the kind of categorization we are making for the products, what are we not included in the CPTs, right? So the kind of supply services, right? So all these things comes under this codes. On a high level note, if you understand, these are the two different codes normally we use. First thing is that procedure codes. Second is diagnosis codes, right? These are the two
Right.
codes. Procedure codes means if there is a healthcare treatment, if there is a medical treatment given by a healthcare provider for a particular person, whatever the procedures are they following, for every procedure, there will be a code number comes under. This is all comes under ICD, right? So this is all comes
Mhm.
under ICD codes itself, right? So common procedure code is what generally they use it, right? So procedure codes. Next is about diagnosis codes. Diagnosis codes means whatever the diagnosis was made by a healthcare provider to a patient, whatever the treatment they are going to provide, prior to that, whatever the diagnosis they have made, for every diagnosis, there will be some code number which will be generated, which is all comes under ICD. This is also called as diagnosis code. So before you are going to create claims, there are two kind of codes which billing person has to update in the claim form. One is procedure codes, which is called CPT, right? So correct
Okay.
procedure codes and all, procedure codes, and second is diagnosis codes. So
Okay.
for this, they have to write some coding here. This is what I have told you. Yeah, this is where generally
Right.
this coding department will do the processing of adding these codes and all everything to the existing codes. This is what generally happens in the second level. The amount of time will be taken somewhere around 2 to 3 days of time will be taken for them to in second and third day. Usually all this coding department processings and all everything will be taken place by taking ICD 9, CM, all these into consideration.
Mhm.
The third thing is about IT department processing. IT department processing, whatever the IT department related means, whatever the claims related systems are we going to use, everything comes under this category. Either whichever the claim management system they may use, either they may be using Paysits, they may be using QNext, whichever the claim system or claim processing system they were using. Whatever the departmental processing happens in context to the claim processing and all, everything happens under third range, the third stage, right? So IT process department. Once the IT department processing is done, the next that information will be carry forwarded to the department where they have to make some follow-ups, right? Because we have to see the follow-ups, wherein we have to make sure that whatever the dues, do we have any kind of dues or not, or something like that. So we have to ensure that, because some people may be paying, because once the claims we have submitted, there is no guarantee. Sometimes we have a patient has to pay some amount as an additional amount, right? So because 100% claims may not happen all the time, right? 100% claim may not happen due to different conditions it is. At the
Right.
same time, not only that, whenever a person wants to get treated, there is some amount of money they have to pay in upfront every time. That's what I told you, right, earlier.
Right.
So all these things in this follow-up of the process, whatever is being initiated, we have to ensure that we have to see and follow up to ensure that whatever the balance dues of accounts do we have and all everything, we have to see in this category.
Mhm.
After that, we have this processes and all everything will be forwarded to the claim scrubber to the insurance companies on the fifth stage.
Right.
Insurance companies, right? So whatever the first, second, third, fourth, right? So whatever the four steps we see in the beginning of the life cycle, all these 4 steps will happens in the healthcare provider area. Right?
Okay.
There are the 2 providers. One is healthcare provider. Second is person who is paying. So it's a payer. We talk about payer. Payer can do an insurance company or something. Right? So or Medicare or Medicare, right? So if they want to do that, generally this information will be carried forward to the insurance companies. This is where generally insurance companies will receive the claims based upon the code numbers what they have updated on the reports. They will verify whether whatever the cost was mentioned, because major, as far as my experience, I can say, major, I don't say obstacle, major adjudications happens based on the cost sometimes. Sometimes cost will vary, right? So because when an insurance company has insured a person, they will mention the cost. I think you know it, right? So they'll mention the cost.
Right.
For this procedure, these many dollars. For this, for example, this is a surgery or treatment. This is the cost which we are going to reimburse, right? But sometimes due to the complexity of the patient, right? Because every patient medical history may not be the same, right? Because sometimes due to the medical condition of the patient, there may be some additional medical support has to be provided by the healthcare provider. It depends on case to case, it will vary. So the price differences will come into picture here. Okay, because as per the procedure itself is concerned, for example, let's say $200 will be for the work, right? But due to the additional medical facilities which will be provided for the healthcare provided to that particular patient because of the medical condition that individual has, assume that there were $50 more added. I'm giving you the rough figures, Shalini, rough figures.
Right.
So $50 more were added. But as per the reimbursement, as per the as per the insurance policy, it will be only $200. But whatever they have claimed here is $250. This is where generally claim adjudications comes into picture. Right? This is one thing. Right? Because insurance companies, where these will be delays and all, everything happen, where delay happens because of this reason. If there is any delay, the delay will happen on the cost, because this is what the cost we have issued to pay. But the amount which was mentioned for that particular procedure or for the treatment was mentioned as different. So
Right.
healthcare providers has a responsibility to explain this. Because whenever the claim adjudication happens for insurance from the insurance company or from CMS or Medicare or Medicaid services, if there is any adjudication happens, whenever it go back to the healthcare provider has to provide the clear justification for that. This is where generally happens in the fifth level. Okay, right? So once the claim adjudication done, followed by this will be forwarded to the posting department, where whatever the payments related information, right, in reference to the balance transfers and all, everything happens on the sixth level. Okay. So from there, whatever the deposits they do, everything is electronic transfers, you know, right? So it is an auto transfer facility where it will be directly credited to the beneficiary account. Either it could be healthcare providers or something like. So healthcare electronic deposits will happen on the seventh level, followed by the subsequently patient statement has to be there. Right? So patient statement has to be provided, because whatever the detailed information about the patient, whenever he is joined in the hospital, till the discharge summary, right? Because discharge summary is also required. Because sometimes I don't say this is a recurring practice. I don't say that, because whoever do this healthcare process and all, usually we follow. But generally, there sometimes one more problem. Let me go back to claim adjudication and tell you. So, in one more problem we get, especially in claim adjudication, is the discharge summary. Okay. Sometimes I don't say people don't do any mistakes in healthcare when they're doing discharge summary, but maybe some mistakes might be taken place in discharge summaries, wherever the problem is discharge summary, because some information they don't mention it very clear. Right. So this is where generally claim adjudications happens. The delay happens on two things. One is the cost of the procedure, whatever the cost of the procedure an insurance company has accepted, versus the cost which healthcare provider has submitted. Right? If there is any difference between these two, this is when adjudication happens in most of the conditions. Second condition comes in discharge summary. Because in discharge summary, sometimes what happens, discharge summary will be prepared by someone, prepared, and finally the discharge summary will be given to the patient, and patient will walk out of the hospital. Right. So that's okay. In this discharge summary, there will be some mistakes. Even grammatical mistakes will also be considered for claim adjudication, where there is a possibility of delay might be taken place in this grounds. Okay, these are the two major areas where if there is a claim delay happens, major reasons are these two. Of course, there were other reasons even, but these are the two major reasons which might be taken place in regular intervals. Okay, this is what we do. Sure. Right. Point number 8 is majorly based on the patient statements. Statement of the patients will be updated here. So once the patient statements and all everything was updated, finally it will be transferred to the collection department, where this accounts and all everything will be updated subsequently. This is what generally the life cycle of a claim which will be taken. Now, go ahead.
For point number 8, where it says patient statements, underneath that it says up to 4 statements are sent. Are these 4 different statements?
4 statements depends on the kind of treatment they have given. Okay, because up to 4 statements depends on the treatment what they have given. Because statement number 1, majorly whenever patient has joined, whatever the medical initial treatment was given, right? First aid or medical treatment initially, whatever we have given, all these will be in the first level. Okay.
Okay.
Second is diagnosis. Whatever the diagnosis is done in the second level.
Okay.
Procedure, whatever the procedure we have followed is the third level.
Third. Okay.
Discharge summary will be the fourth.
Fourth. Okay. I understand.
It is simple, right? It's a letter. It
Yeah.
is very simple. Patient has went to the hospital. Initial treatment or initial screening was done. After that, there is some diagnosis was made. After diagnosis, there is a procedure of medical procedure was done. Either it could be a general medication or it could be surgery, whatever it is. Right? Procedure was done. Once the procedure is completed, patient will be delivered. So patient will be discharged. Sorry, patient will be discharged. Right. So for the discharge, so there are statements because statements. Because see, every cost has to be mentioned, right? Because statements will be more. Right. Statements will be more because they have to mention for everything, even for the needles, right? So they have to mention every cost, how many medical procedures they have used. Is there any emergency kit? Sometimes, as I told you, there will be some emergency medical equipment might be used, might be required for a patient if there is any treatment is going on. When you are comparing with the common districts, right? So, so that cost will also be included in it. So there must be a justification has to be provided by the medical healthcare providers and all everything on this grounds. That's the reason why generally these patient statements will be allowed usually to 4 statements. That is what generally we see. Okay. Understood? Clear, Shanti?
Yes. Yes.
So this is what generally the life cycle of a claim. Now I'm going to discuss about the kind of code numbers. What is that we use? Please write down. I think it is always this screenshot is more useful to you. Please take a screenshot of it.
I did.
Right. So there are 3 different things here. One is about provider. Second is a payer. Third is a sponsor. Right? Sponsor. 3 people. Now, provider. When you talk about eligibility verification, a person has went to the hospital or to the healthcare provider. First of all, enrollment. Right? So enrollment, wherein the kind of eligibility inquiry I'm talking about, right? Not the enrollment process, because enrollment process and all everything, here it comes. When you talk about eligibility inquiry, the kind of code number we use is 270. Please make a note. Eligibility inquiry, the kind of code number will be used is called 270. Okay. Now, in against to the inquiry was made, whatever the response was given, that comes under 271.
I see. Okay.
Okay. So 270. See, there are responses, right? So you have given a reply. You have given a mail. You got a reply, right?
Right.
So whatever the code number you are using to send a request is 1, and whatever the reply you are getting from another end comes under the other code. Okay. So eligibility inquiry, the kind of code number what is that we use is called 270. Against to that, whatever the responses we were getting comes under 271. Okay. Now, next, pre-treatment authorization and reference, because before any treatment has started and all, pre-treatment authorizations and referrals will be taken place, pre-certifications, all that. So in context to that healthcare service delivery, the kind of code number what is that we use is called 278.
Okay.
Please write down 278 for healthcare services delivery. 278 will be used.
Yes.
Now, to submit claims, the kind of code what is that we use is called 837. Once the billing is done, whenever the billing is done, once the summary reports of the patients, everything is completed, we have to send the claims, right? So we have to send the claims for the acceptance. So whether it is accepted or rejected, but we send these claims for the acceptance. Maybe there may be some mistakes which may get rejected sometimes, wherein we have to do the needed corrections, and again we have to send it back. But For claim submission, the kind of code number, what is that we use called 837. Okay. Now, once the claim has submitted, what is that they have to do? They have to see the status, right? To what extent the status would be. If you want to know that, status inquiry is 276.
Okay.
Inquiry, okay? Remember that. Status inquiry from where? From healthcare provider to payer, insurance company or Medicare, Medicaid, CMS department, whichever it is. So claim status inquiry will fall under 276. Response to the inquiry comes under 277.
Okay.
Response against to the claim status will be 277.
Okay.
Claim payment comes under 835.
Okay.
Claim payments comes under 835.
Okay.
Understood? Right? So these are the major ones. So eligibility inquiry 270, response will be 271. Right? So 270, 271 completely focused on the eligibilities related stuff, eligibility inquiry and responses.
Right.
Healthcare delivery services deliveries 278. Whatever the claim related payments, claim related submissions and all comes under 837 and 835. Okay, 835 for claim submission, 837 for claim submission, 835 for claim payments. Status inquiry falls under 276, 277 equal. Understand? Clear. Right?
Yes.
Next, when you talk about enrollment for enrollment purpose, it is 834.
Okay.
Enrollment from a payer to the sponsor, it is 834.
Okay.
Whatever the payment
who's
order was received, yeah, please go ahead.
Who's the sponsor here?
Sponsor can be anyone, right? So sponsor may be a company, right? So a person who is working there, right? So sponsor.
Okay. A company as an
Person-
insurance company?
It's not an insurance. Insurance company is nothing but a payer, right? He's the person
Right.
who is going to pay that, right? Payer.
Right.
Provider, payer, sponsor. Okay, patient, 4 people. Okay. Again, I'm
Okay.
repeating. Let me show you. I have a diagram prepared on this. I will show you. Yesterday I have created it. It's in my Canva book. I'll show you. Because there are 4 people, Shalini. One is healthcare provider. Okay, hospitals. Payer.
Yes.
Payer, who is payer? Insurance company.
Insurance company. Yes.
Third is patient. Means a person who is getting treated. So this person is called patient. Let me talk. Right. So next is about sponsor. Sponsor means an insurance company. It could be. Understood, right? Clear. It could be an insurance company. Sorry, it could be an organization where that individual is working. Right? So it's called as provider.
Okay.
Understood? Clear?
Yeah.
Yeah. So this is what the point is. This I have prepared yesterday, right? So these are the healthcare providers where you can see payer
Right.
here, right? Payer means nothing but a person who is paying against to the insurance thing. I mean, insurance or insurance companies or Medicare, Medicaid. Next
Right.
is patient.
Right.
Second is healthcare provider or healthcare provider, whatever it is. Fourth one is sponsor. Sponsor means who is sponsoring this. This is what we call it a sponsor. Sponsor can be anyone. So sponsor may be a person who is getting enrolled or something like. Sponsor can be anyone, either by itself, by individual itself, or else if a person is coming through an organization and all everything, that sponsor may be often. Right? For example, on behalf of an employee, employer is sponsoring, right? Healthcare benefits.
Okay.
Understood? Clear, right?
Yes.
So enrollment process has to happen, which enrollment process for that 834 is being used. In context to against to that, whatever the payment order we have received is called 820. Clear?
Okay. Yes.
Do you understand this, right?
Yes.
So this is what a high level understanding. Of course, I have not entered into the detailed part, how it happens, stepwise procedures. I have not explained so far. That I'll explain one by one in coming days. So this
Sure.
is what in high level understanding over how this claim processing happens, what are the steps we have, and whatever the general procedure codes we use, right? So whatever the code numbers we use and all is
Right.
what this is all about. Yes. Right. So if you have any questions, you can ask.
Okay.
Any questions on this?
No questions.
Clear, right?
Yes.
So the detailed part of this ICD code says, right? So we have few more information to be discussed with, which is in reference to HCPSS, all that. And at the same
Right.
time, what are the important fields we have to mention? We need to discuss about PPACAs, all that, right? Patient Protection and Portability Act, all that. So this I'm
Right.
going to discuss in tomorrow session. Clear,
Okay.
Shalini?
Tomorrow, actually, yes. Tomorrow, can we maybe change the time a little
Sorry.
bit?
Tomorrow is Saturday, right? Tomorrow I
Yeah.
told you that I've taken Saturday. Only this Saturday. What time is
Right.
available to you?
What time is it over there right now?
It's evening 7:30 for me.
Okay. How late can you do it in your time?
Actually, weekend tomorrow Saturday I'll be at home. 90% I'll be at home. I don't go anywhere. But not guaranteed sometimes. Because again schools were starting. It's about to start.
Right.
Maybe there is I can take. Is it fine sometime by tomorrow start at 10:30? Even though it is late, I come by 10:30. No problem. 10:30 is fine
Okay.
for you.
10:30 your time, and so
PM.
it would be
10:30 PM, which will be your 1 o'clock afternoon. Time.
Yeah, that's fine. If you want to do 9:30, that's fine too.
I will see 9:30 or 10:30. I will update it. I will update to
9:30 is fine. Yeah.
I'll
So
update
your
one
9:30.
regarding that.
Okay.
Either
Okay. So if you
9:30
do,
or 1:30.
yeah.
Anyone.
Okay, that's fine. Whichever works for you. I'm good